Dental oral health is an essential part of our overall health and well-being. We often ignore our dental health until the problem becomes much worse, and poor oral health hygiene can lead to many problems. It might be linked to any of the systematic problems like heart disease, cancer, or even diabetes. And maintaining a healthy lifestyle and teeth is as important as we maintain our physical and mental health. So now that we are here on an episode of Welcome Wellness, and we have Dr. Savneet with us. So let's welcome her to this episode of Welcome Wellness. Also, I'm your host, Alka. So let's start with the episode today. Hello, Dr. Savneet. How are you?
I'm good. Thank you. Thank you so much for a warm welcome. Uh, it's my pleasure and honor to be on this platform. And you guys are doing an amazing job. It's a great initiative by Trident Communication.
Thank you so much. And thank you so much for taking out time for this episode of Welcome Wellness. So, ma'am, now that you're here and we have a plethora of questions with us for today's episode. So the first question goes like, what are the causes of toothache?
So toothache can be due to many reasons. The first of all, it can be due to a dental cavity. Basically, cavity which happens, the caries that happen and can lead to enamel decay. Secondly, it can be happen due to gum inflammation. And third, it can be due to abrasion and erosion of the dental layer. So that are the main three reasons for because of which toothache happens.
All right. Yeah. So I see a lot of people have teeth stain, and with teeth stain, it so happens that people usually consider that it's because of the usage of tobacco. But then I know people who are not using tobacco and they still have stained teeth. So what can be the reason behind that?
So stained teeth mainly happens because of intake of too much of caffeinated drinks like tea, coffee. So having 4 or 5 cups of tea or coffee in a day, then probably you will have brown discoloration on your tooth surface. And it can happen also because of intake of a high intake of wine. 1 or 2 glasses is perfectly fine, but if you're having too much of wine, then also tooth stain occur. And as you said, tobacco and chewing of tobacco and smoking are the major reasons because of which stains happen.
Yeah. All right. So what can someone do to overcome these stains?
So as I told you, you have to minimize your intake, first of all. If you're having too much or you are like really addicted to caffeine, you should have a glass of water or you should rinse your mouth after having a drink or so. So that are the 2 things which one should do.
All right. And what can be the reasons behind dental caries or cavities?
So our mouth is full of good bacteria. But when we create an acidic environment in the mouth by having too much of sugar intake, by having too much of acidic food, that can lead to a decay of we have to really minimize the intake of sugar. We have to really minimize acidic like Pepsi, cola, or anything which is too acidic. Too much of lemon juice, like lemonades, can also be really harmful because they are also acidic in nature.
All right. So we see this on ads a lot that people suffer from sensitivity. So what can be the reason that teeth become too sensitive to hot or cold?
So teeth are basically made up of 3 layers: the enamel, the dentine, and the pulp. When we do a lot of aggressive brushing, it damages the outer surface of our teeth. And we end up losing the hardest surface, which is the most protective surface of a tooth, that is the enamel. So that is why when a patient comes to us, we always tell them that we have to, more than the toothpaste, it is the brushing that is important. We have to really watchful of a way we brush. We don't end up using too hard or hard bristles or end up doing too much of brushing. So this leads to sensitivity. This is the major reason of sensitivity. So other than that, the cavity and of course dental caries is definitely can lead to hot and cold sensitivity.
So like too much of brushing, can that also lead to bleeding gums, or what leads to it?
So bleeding gums similarly have a lot of reasons. First and the foremost is the deficiency of vitamin C. So one should really be careful. If you are not having a proper vitamin C intake, then it can lead to bleeding gums irrespective of whatever you do as a maintaining dental hygiene. But other than that, if you're not maintaining your dental hygiene and there is a lot of calculus and plaque that deposits on the surface of the tooth, it damages the gingiva and can lead to recession. So you should be careful and you should get scaling done so that you don't end up having bleeding gums.
Okay, so it so happens that sometimes when we are not taking proper care of our health, like we are not eating at regular times, so we end up having mouth ulcers. what else can be the reason of having a mouth ulcer or like oral cancer?
So this is a very, very important question that comes to me from my patients as well. So dental ulcers, if one is not wearing any prosthesis for, I mean, any artificial set of teeth, if you're not wearing and you have a normal, natural set of teeth, then dental ulcers are more because of your gastric influx or indigestion. It is not related to a dental thing if you are not wearing any artificial set of teeth. If you have artificial like dentures or in a removable thing or a crown for that matter, in that cases dental ulcer can be due to any damage to the mucosa, but other than that it is mainly because of your gastric influx which happens.
Yeah. What about oral cancers? How do
So oral
people
cancer,
usually develop oral cancer?
one of the major reasons of oral cancer would be tobacco chewing and smoking, like everyone knows. Other than that, if one is wearing an ill-fitted denture or any prosthesis that is damaging the mucosa by irritating it continuously, and you're not taking care of it, then can lead to ulcers and ultimately can be lead to a cancerous lesion.
All right. So nowadays we see that a majority of the people, they're suffering from black fungus. So what exactly is black fungus?
That's a major post-COVID thing that has come up. So black fungus is basically mucormycosis, and it is happens when there is an immunocompromised patient, and the immunity of the patient is compromised because of intake of too many steroids when they were getting treated with COVID, or they have their sugar levels are not normal, they're diabetic. Then black fungus kind of a thing happens, and it is basically as a dental point of view. You can see a black discoloration on the bridge of the nose or the palate, or there is loosening of teeth, and you should be watchful of your symptoms and should show it to the dentist just in case you feel that there is something coming up like that.
All right. So a majority of the people also complain about tooth crowding and gaps between the teeth. So how can one overcome such issues?
So tooth crowding and gaps, the one thing that one can do is go for braces or aligners. These are the best two treatment plans for patients with crowding as well as spacing for that matter. So aligners and braces are doing the same function, but they are completely different. So aligners are like retainers and they are transparent, and they are removable. So one cannot, if somebody is too conscious of having braces, then person can go with aligners. And aligners, you can just remove it while eating. You can remove it when you are publicly going out or socially active, and you have less visits to the dentist as well. So you get a full pack of your aligners beforehand, so that you can just wear it accordingly per month. And braces are fixed, they are not removable, so you have to be with the braces for at least 1.5 years so that your teeth can be given a proper shape. So braces, you have to change your habits, but at the same time braces are comparative to aligners, they are cost effective. So you have different things for different set of people, whatever one can choose, but you can always get your teeth aligned and with both these options for any of this, for that matter.
So people also go for dental implants. So what exactly are dental implants?
Dental implants is a titanium screw that we put inside our bone, and we leave it there for at least 3 months, and then we give a tooth on top of it. So it is just like a replacing a normal tooth, a root of the tooth with a screw kind of a thing, and then you can have a normal tooth on top of it. So that is a implant, and it is these days it is one of the things that is done a lot, because this is you don't end up damaging your adjacent teeth when you are giving a patient dental implant. It is always better than a dental bridge.
All right. So what are the cases when you would advise someone to have an implant?
So implants, first of all, implants can be given to, if you don't have any medical history, if you are medically fit, you don't have diabetes, or your sugar levels are not fluctuating, anybody and everybody can have a dental implant. Dental implant, when you don't want to involve your two adjacent teeth, you can go for a dental implant because it end up saving the natural structure of the tooth, which is destroyed when we give a dental bridge. Only in patients we have any medical history or taking any other medications which are ultimately decreasing your immunity or your uh, like sugar, you are depleting your thing, then you don't end up telling them to go for a dental implant. Otherwise, everybody can go for a dental implant.
All right. So, what are some of the tips that we can, enlist for a good oral hygiene?
So, oral hygiene, first of all, as you all know, brushing is the basic thing that one should try doing it morning and evening. It should be done 2 times a day, not more than that, not less than that, and it should be done for 2 minutes. So, 2 times a day for 2 minutes is the key. And other than brushing, one should always use a tongue cleaner, interproximal brushes, floss, and all with all these things. Mouthwashes also play a lot of role. So mouthwashes and betadine gargles, they are very good in maintaining a proper good environment in the mouth. And that's it.
All right. So now that we know that it is a COVID world right now that we are in, so is there one message that you'd like to give to our viewers?
Message is, as a dentist, I would really like to like that people should really work on their oral habits. And so our mouth is a gateway for all the bacteria and the viruses. So if we start taking care of our oral hygiene, we will be definitely far from these viruses which are troubling everybody around. So brush and take care of yourself. That is what it is.
So thank you so much, Dr. Savneet, for being with us on this episode of Welcome Wellness.
Thank you, Alka, for giving me the opportunity. And in case you guys have any inquiries, you can follow us on our Instagram handle, Dr. Savneet Kaur.
And thank you so much, everyone, for joining us today on this episode of Welcome Wellness. A new episode of Welcome Wellness always airs up on Sundays. So just subscribe to our channel and stay tuned until the next one airs up. So just take care, stay tuned, and bye-bye.